Medication administration is an important nursing responsibility. As you'll see in the skills demonstrated in this module, it requires careful patient assessment and proper technique. The most common route of administration is the oral route. Capsules, tablets, and liquids taken by mouth are absorbed in the stomach or the small intestine. Medications may also be administered through a gastric tube. Topical medications are also common. These are applied to skin or mucous membranes. Eye and ear drops, suppositories, transdermal patches, and inhaled medications are all topical medications. Safety is a top priority. It is helpful to keep the following in mind. Prepare medications for one patient at a time. Review the patient's chart for allergies or any contraindications. Always identify the patient prior to administration. Perform the 3 checks and ensure the rights of medication administration. In addition, the same nurse should prepare the medication, administer it, and document the administration. Remember, this is your patient, and you are ultimately responsible. Ensuring safe and accurate medication administration is an important part of every patient's plan of care.
Deborah, Ryan, I'd like to review some things with you that are fundamental to administering medications properly. I'm talking about the 3 checks and the rights of medication administration. Both of you will be administering medications to your assigned patients today, so I want to review these important concepts now. Ryan, what can you tell me about the 3 checks?
Well, it's one of the ways we can make sure medications are being administered safely.
Right. And Deborah, what does the 3 refer to in the 3 checks?
It means that the medication package or container should be checked 3 times during medication preparation and administration.
Correct. Why?
The label must be read 3 times to ensure the right medication is going to the right patient.
Exactly, so that the right medication goes to the right patient. The 3 checks work like this. 1, read the label whenever you reach for the unit dose package or container. 2, read it after you take it from the drawer and compare it with the medication administration record, the MAR. And 3, before giving the unit dose medication to the patient. Any questions?
So, basically, read it when I reach for it, when I compare it to the MAR, and before I give it to the patient?
Essentially, yes. You read it those 3 times before administering the medication.
What about when the medication is delivered in a multi-dose container?
Well, then the label is checked for the 3rd time before you place the container in the drawer or medication storage area.
I see. That makes sense.
Moving on to the rights of medication administration. Deborah, what are they designed to do?
They're to help ensure accuracy and prevent errors when administering medications.
Correct. And what are the rights of medication administration used to ensure?
That the right medication is given to the right patient.
In the right dose, through the right route, at the right time?
Right. Correct. Now, why is this crucial, Deborah?
Because one little mistake can have big consequences.
That's right. Additional rights have been suggested, including the right reason and the right documentation. What do you think, Ryan?
Validating the right reason makes sense. It requires a nurse to understand the rationale for administering the medicine.
Yes, and you ask yourself the question, does it make sense?
And why is it important to ensure the right documentation?
You always have to make sure the documentation is accurate and the administration is timely.
True. Using the 3 checks and the rights of medication administration will help you avoid errors when administering medications to your patients every day. Okay, on with the care of your patients. So, before you administer the medication scheduled for 9 a.m. for your patient, I want to go over how to prepare unit dose medications for administration.
That'd be great. My first patient has a few prescribed medications.
Now, you should know the actions, special nursing considerations, and safe dose ranges for the medications to be administered.
And also the purpose of the administration and any adverse effects, right? And make sure my patient doesn't have any allergies.
Right. You are responsible for your patient's care and need to consider the appropriateness of their medication. And always make use of the 3 checks and the rights of medication administration. So, what's first?
Perform hand hygiene.
Of course. Okay, then you would gain access to the medication storage unit.
Okay, I enter the passcode into the computer and choose the correct patient.
And remember, we only prepare medications for one patient at a time, okay? So what's next?
I read the medication administration record, the MAR, and select the proper medication. According to the MAR, my patient gets one multivitamin tablet PO daily. Administering a multivitamin, a dietary supplement, is appropriate given the fact the patient is having some difficulty maintaining sufficient food intake. So I take the appropriate package out of the medication drawer.
Right, so that's check 1. Check 2 is to compare the package label to the MAR and check the expiration date.
Looks good. And I place the unit dose package medication into a disposable cup. Does it matter if I open the unit wrapper now or when I'm ready to give it to the patient?
Only open the unit package when you are with the patient and ready to administer the medication.
Okay, don't open the package until I'm at the bedside.
Right.
Next is 0.125 milligrams of digoxin PO daily. Administering digoxin also makes sense, as she has a history of heart failure. So, do check 2 again. Compare the medication label to the medication administration record. That's right, and put it into a cup.
Good. Placing the digoxin in a separate cup is the right thing to do. In fact, you should always keep narcotics and medications that require special nursing assessments in a separate container. Do you know why?
In this case, yes. Before this medication can be administered, I have to take the patient's apical pulse rate for 1 minute. And the order says if the apical pulse rate is less than 60, I should not administer the digoxin.
And if it's less than 60, you should also notify the primary care provider.
Okay, right. So, the last medication she needs is 20 milligrams of furosemide. Furosemide is also used to treat heart failure. And her serum potassium level and blood pressure were within normal levels when we checked earlier. So again, it's appropriate to give this med to this patient.
Okay.
So, I'll get it out. Do check 2. The furosemide can be placed in the same cup as the multivitamin?
Yes, it can. Good.
And that's it. These are all the medications she needs at this time.
Now, depending on facility policy, you may perform the third check of the medication labels with the MAR now before taking them to the patient. However, here, we'll do the third check at the bedside after confirming the patient's identification. Now, before we go out, exit out of the medication supply unit.
Right. And we'll bring the bedside computer and the medications. I already got her fresh water.
Good thinking. Keep in mind you should transport medications to the bedside carefully and keep the medications in sight at all times. Okay, let's go see your patient.
Katie, sometimes the dose specified in an order is different from the dose contained in the provided tablet. So it may be necessary to break the tablet to obtain the right dose. Now, your patient's doctor has prescribed 2.5 milligrams of prednisone for the patient to be taken in the morning with food. However, the pharmacy has provided prednisone 5 milligram tablet.
Well, in that case, the tablet should be broken in half in order to give the right dose.
Right, but keep in mind only scored tablets should be divided because this ensures an accurate dose. Now, you may need to do it yourself, as in this case, or the pharmacy may break the tablet before dispensing to the patient's supply.
Okay.
Okay.
Well, first I'll check the MAR. Then take the medication from the cart.
Good.
And compare it to the MAR. Then I'll check the expiration date and perform any necessary drug calculations. So since the prednisone is a 5 milligram tablet and the patient requires 2.5 milligrams, breaking the tablet in half will give me the right dose of 2.5 milligrams.
Good. Now, there are 2 ways to break tablets. You can either split them at the score, or you can use a pill cutter.
I think I prefer the pill cutter.
I think that's a good idea. You'll find it there in the top drawer.
Okay.
Good. Okay. So what do you do now?
So now I'm going to put on gloves.
Good.
And next I remove the medication from the package. Then I check the package against the MAR. That's my third check. I put half of the tablet in a cup for the patient, and I discard the other half. I can take my gloves off now because I won't need them after this point.
Good. Then the medicine would be administered to the patient. That's
Great.
excellent. Melissa, your patient is to receive 400 milligrams of guaifenesin, which comes as a liquid medication. Can you tell me what's the procedure for preparing liquid medications?
Okay, you can compare small volumes of liquid medication using needleless syringes or graduated liquid medication cups.
Okay, so let's use the graduated medication cup. Now, start by unlocking the med cart. Very good.
Okay, so first I check the MAR. Then I get the medication from the cart. The physician has ordered 400 milligrams of guaifenesin to be administered at 8 a.m. So, according to the bottle, guaifenesin is 400 milligrams per 10 milliliters. So that means I'd prepare a 10 milliliter dose.
Exactly.
Okay, so second, I check to compare the medication label against the MAR.
Right.
I check the expiration date and make the drug calculations, which I've done.
Okay. So now you're ready to prepare the dose.
I'm going to put the graduated medication cup on a flat surface and move so that I'm at eye level with the cup. I read the medication amount at the bottom of the meniscus as I pour. So,
Okay, good.
here goes.
All right. Good. Now, just be sure you wipe the lip of the bottle with a paper towel after you pour the medication. You see, when liquid drip onto the bottle, it makes it hard to read the label.
Right. And
Good.
all done. Now I compare the bottle once again with the MAR. It's my third check before I put it back in the medication cart. And I'm ready to administer to the patient.
Right you are. You are doing just fine, Mark.
Thank you.
Do you have any questions?
No questions.
Okay. Let's see what we have here. Mark, your patient has been prescribed 325 milligrams of aspirin to be administered once a day orally. Now, it's packaged in a bottle containing multiple doses of aspirin. Can you tell me what's the proper procedure for preparing one dose?
First, I would check the MAR for accuracy.
Okay.
Then I would select the right bottle from the cart.
Well, actually, you don't need to do all that right now. You know what you need to do?
What's
Give
that?
some hand hygiene. Let's move out. Go wash your hands.
Okay.
I don't think it's necessary to do all that until you wash your hands.
Now I can check the MAR.
Now you can check the MAR.
Now
Okay.
I can check the MAR.
All right.
And I select the right bottle from the cart.
Good. That's check one.
Let's check one.
Okay.
Next, I compare the MAR to the bottle.
Check two.
I check the expiration date. And finally, I do any drug calculations as necessary. And finally, I pour one aspirin into the bottle cap and then into the disposable cup. 1, 2, 3, 4. That's okay. So should these be discarded? Or?
No, that's not necessary.
Okay.
The extra tablets can be returned back to the bottle.
Oh, really? Okay. All right. Okay, so now I put the tablet I need into the disposable medicine cup.
You'll do the third check of the label, comparing it with the medication administration record before returning the bottle to the drawer. And then you'll be ready to administer the aspirin.
Okay, gotcha.
Okay.
Looks good.
Listen, y'all did a good job administering your medications today. I'm very, very proud. Thank you. But I just want to take a moment to talk about some situations that could arise that you may not anticipate. Okay, Mark, what would you do if a pill you were giving a patient fell on the floor?
Well, the 5-second rule, you can still give it to them. No, I'm kidding. There is no 5-second rule.
Okay.
If the pill falls on the floor, it is wasted and it can't be used, then I would discard it according to policy. And then I would identify what medication it was and get a replacement medication.
But what if you can't tell what the medication is?
If you're unable to identify the medication or in doubt, just consult the pharmacist for proper identification. But you should administer the missed dose as soon as possible, all right? Katie, different scenario that you may not anticipate. You arrive in a patient's room with his routine medication, but...
Mr. Buckley? Mr. Buckley?
I'm in the can.
Oh, I have your medication for you.
Well, I'm gonna be a minute. Just leave it by the bed and I'll take it when I'm done.
So, Katie, how would you handle this?
I guess I wouldn't just leave it because someone might tamper with it.
Okay.
Or it might get thrown away, or even worse, someone else might take the medication by mistake. And I'm, personally responsible for making sure that the patients actually swallowed the medication, so I'd need to be present at the time.
Okay.
So I guess what I would do is... I'll come back with the medication in a few minutes, Mr. Buckley. Just ring the call bell when you're ready.
Okay, that sounds good.
Okay.
Well, that's the response I was looking for. All right, Melissa. Say you prepared a patient's medication, and after checking their ID band, the patient says,
"What's this? This doesn't look like the pill I took yesterday. Yesterday was a green pill. This isn't a green pill. Where's the green pill?"
Well, this is your iron supplement, and you are to take it with each meal.
"But this isn't what I took yesterday. This pill is red. The pill I took yesterday was green. Very green. I've never taken a red pill. My pills are green."
Well, I would recheck the package against the MAR, and then I'd recheck the administration time, and then recheck the MAR with the original order on the chart. Okay. Now, if the patient continued to insist, or I still had some concerns, then I would consult his doctor and make sure that this is in fact medication he should be receiving, and just, clarify the order.
Exactly. So does anybody have any questions? No? Well, good work today. I'm proud of
Okay, we've got our medications ready, and we've checked the labels twice. Now, before we administer these to your patient, what can you tell me about oral medications, their properties, how they work?
Medications have a slower onset when taken orally. This route has a more prolonged but less potent effect than other routes.
Right. And what else should you keep in mind?
The actions, special nursing considerations, and safe dose ranges of the medications to be administered.
And also the purpose of administration and any potential adverse effects, right?
Yes, and check for any allergies the patient may have. Bottom line, I'm in charge of the patient's care and need to consider the appropriateness of the medication.
And of course, always make use of the 3 checks and the rights of medication administration. Ready?
Sure am.
Okay, let's get your stuff. Go see Miss Lemon.
Good morning, Miss Lemon. I'm Ryan. How are you doing?
I'm doing well, thank you.
Good. I'm glad to hear that. This is Miss Warren. She's my nursing instructor. And I'm here to give you your medication. It's scheduled for 9 a.m.
Okay, that's fine.
Okay, sign in on the computer and confirm her ID.
All right. Now I'll need to check your ID band. Can I have a look? Thanks. And can you tell me your full name?
Eileen Lemon.
And your birth date?
February 3rd, 1951.
Thank you, Miss Lemon. I'm just going to scan the barcode on your ID band. and we're all set. Now, according to your chart, you don't have any known allergies. Is that correct?
As far as I know.
Okay, I'm going to check your heart rate before I give you your medication.
That's because of the digoxin, right? That's for my heart. I checked my pulse at home when I first started that medication.
I see, yes. I'm checking your heart rate because of your digoxin. Is it okay if I put my stethoscope under your gown to take a listen?
That's fine.
Just going to need to unbutton you here and over here. Everything sounds good. 72.
Ryan, it's important to explain to Miss Lemon about the purpose and action of each medication before you administer them.
Right, I'll do that as I go along.
And you want to remember to check the medication labels for the third time with the medication administration record, the MAR.
Okay, right. The first one checks out. All right then, Miss Lemon. We're ready to start with your first medication. This is a multivitamin. It's to make sure you get at least the minimum daily requirement of nutrients. Would you like it in a little cup?
Yes, please.
And would you like water with this?
Oh, yes. I'm not the best pill taker.
Me neither. So, here's the vitamin and some water.
That's good, Ryan. Always offer patients water, if allowed, and the option of taking the medications by hand or in a cup.
All right, Miss Lemon. Your next medication is digoxin. We've already talked about that one.
Yes, we did.
And of course, you'll check that against the MAR.
Right, and it checks out. Here you are, Miss Lemon. And some water?
Thanks.
You remain with the patient until each medication is swallowed and never leave medication at the patient's bedside.
Got it. Okay, Miss Lemon?
Yes, the water helps.
And always wait to document the medication in the MAR until you've actually seen the patient take it.
Okay, one more to go. Your furosemide. I'll just check it against the MAR. This drug also helps your heart. Since it increases how much urine you make, you should take it early in the day. Do you take it early in the day at home?
Yes, I do. I've been taking that for a while, too.
And here you go.
Okay.
That's all, Miss Lemon.
Thank you. I'm glad you brought my pills on time. At home, I use a checklist to remember to take them. I have a checklist for everything. Don't know where I'd be without them.
I use a lot of checklists, too. To keep track of schoolwork.
Okay, Ryan, let's document the heart rate you obtained and confirm the administration of the medications in the computer. And once all of the medications have been administered, you'll want to evaluate the patient's response to the medications within the appropriate time frame for each drug.
Okay. I think that about does it.
Thank you, Miss Lemon. Is there anything more we can do for you before we go?
No, I'm fine. Thank you.
I'll be back soon. Just use the call bell if you need anything before then, okay?
I will.
Ryan, what can you tell me about your patient?
He had oral surgery for tongue cancer, so he has a gastrostomy tube for supplemental feedings.
To help him consume sufficient nutrition?
Right. It's also difficult for him to swallow his medication because of mouth ulcerations related to chemotherapy. So we're using his gastrostomy tube for medications as well.
I see. Then you'll use liquid medications whenever possible. Why do you think this is?
They are readily absorbed and less likely to cause tube occlusions.
Right. Now, certain solid dosage medications can be crushed and combined with liquid. These medications should be crushed to a fine powder and mixed with 15 to 30 milliliters of water before delivery through the tube.
How about capsules? Can you open those and use them?
Yes, certain capsules can be emptied into liquid and administered through the tube, but you should always check manufacturer recommendations and verify with a pharmacist first.
Okay.
Now, do you have all the equipment you need?
Yes, I have an irrigation set in the room. I also brought a waterproof pad to help keep the patient and bedding dry.
Okay, so what do you need to know before we administer the medications?
I need to know the medication's actions, any special nursing considerations, the safe dose ranges,
Purpose of administration.
Right, of course, and any adverse effects of the medications.
Consider the appropriateness of the medication for the patient too, and always make use of the 3 checks and the rights of medication administration. So, what's first?
Perform hand hygiene.
Okay. We'll now gain access to the medication storage unit.
Okay. I enter the passcode into the computer and choose the correct patient. Then I read the medication administration record, the MAR, and select the medication from the medication stock, which is the first check. So first is famotidine 40 milligrams. Seems appropriate to decrease gastric acid related to stress.
Correct. Next, compare the label with the MAR, which is the second check, check expiration dates, and perform any calculations necessary.
Okay, famotidine 40 milligrams. Yes. The dose ordered is 40 milligrams. The package is labeled 20 milligrams per 10 milliliters, with 20 milliliters in the package. So, I need 20 milliliters to make the correct dose, so I'm using the entire package contents to make the 40 milligram dose.
Right. And since famotidine is a suspension, you need to shake the container prior to opening to mix the medication.
Suspension shake before opening. Okay.
What else?
Next medication. Read the MAR and select the medication from the unit stock. Lisinopril, 20 milligrams, which is the first check. Again, it makes sense to administer this drug, as he has hypertension.
It's good thinking. What's next?
Then, compare the label with the MAR, which is the second check, and check the expiration dates.
Is there anything you would want to know about your patient before administering this drug?
Yes, since it's prescribed to treat his hypertension. To lower it, I should be aware of the patient's blood pressure before administering. I just obtained a blood pressure measurement. His blood pressure was 132/78, so it's okay to administer, right?
Yes, that's correct.
Oh, Miss Warren, this is a tablet.
Yes. So what do you need to do since we're administering via gastrostomy tube?
Well, I can check to see if it can be crushed safely, right?
Yes. Let's look at our medication reference.
It can be crushed and mixed with water, which would be appropriate for putting through the tube, right?
Correct. So grab the pill crusher and put on some gloves. Place the tablet in the crusher.
Okay, grind a tablet. Now, I dissolve it in water.
Pour 15 milliliters of water into a plastic medication cup. Add the medication and stir it until it dissolves. Keep the medication wrapper with the dissolved tablet so we can recheck the medication again before we give it to the patient.
Sounds good.
Any additional meds for now?
Well, for this time period, that's it.
Okay. Now, depending on facility policy, you may perform the third check of the medication labels with the MAR now before taking them to the patient. However, we will do the third check at the bedside after confirming the patient's identification based on facility policy. What else do we need to do?
Clean the pill crusher. Okay, so I'm ready. And I sign out of the medication supply unit before we go. And bring the bedside computer, right?
Yes, and when you transport the medications to the patient's bedside, be sure to do it carefully and keep the medications in sight at all times. Okay.
Mr. Esposito? Hi, you remember me? Ryan? This is Miss Warren, my nursing instructor. We have your medication for you. Mr. Esposito has been having some difficulty speaking. I'll try to keep my questions to a minimum.
Good afternoon, Mr. Esposito. We met earlier. I hope you're feeling a little bit better.
Can I double check your ID band, please? Thank you. Your name and date of birth.
Michael Esposito, July 6, 1943.
Great. Now I'm going to scan your ID band, Mr. Esposito. Thanks. Okay, I see you don't have an allergy bracelet on. So, do you have any allergies?
No, not that I know of.
Good, thank you. Since it's hard for you to swallow, we're going to give your medications through your tube. That way you don't have to swallow them.
Thanks.
You're welcome.
Now, he should be sitting as upright as possible.
Okay, I'm going to put your head up a bit, and I'm also going to raise the bed. Good. How's that feel?
Fine.
Okay. You'll want to remember to check the medication labels for the third time with the medication administration record, the MAR. Okay.
Okay, they both check out. So, we're good to go, Mr. Esposito. Just 2 for now. I have your famotidine to decrease your stomach acid and reduce stomach irritation, and your lisinopril for your blood pressure.
Yes, I've been taking both those for a while.
Good. You remembered your gloves. Why don't you walk me through what you're going to do?
Well, I already changed the irrigation set and filled it with fresh water.
Okay. Here you go.
Mr. Esposito, is it okay if I move your covers and gown?
Yeah.
Let me put this pad under here just to keep you dry. So, the tube's already clamped. I remove the end cap and attach the syringe to the port for medication administration and unclamp the tube.
Attempt to aspirate and note the amount of any residual.
Right, got it. There's no residual. Now, I apply the clamp on the feeding tube again and remove the syringe.
Good. Then what?
Remove the plunger from the syringe. Reinsert the syringe into the gastric tube without the plunger. Pour 30 milliliters of water into the syringe. Now, I unclamp the tube and let the water enter the stomach via gravity infusion.
Next, you administer the first dose of medication by pouring it into the syringe.
Okay.
Now clamp the tube. Since you're giving more than one medication, follow this medication with a 5 to 10 milliliters water flush before you give the next drug. So pour 10 milliliters into the cup that the lisinopril was in. This will rinse the cup and provide your flush.
Okay, 10 milliliters of water, pour into the syringe. Unclamp and allow to flow in.
Now reclamp it, set it down, and shake the famotidine, and you'll pour it into the syringe. All right. Unclamp and administer to the patient. Reclamp it again and pour a little water into the cup to rinse. And unclamp. Now reclamp. Since you are finished with the medications, you should pour 60 milliliters of water into the syringe to make sure that the medications are completely removed from the tube. Unclamp and allow the water to flush the tube.
Then I clamp the tube, right?
Mm-hmm.
Remove the syringe and replace the end cap on the tube.
And if the patient were receiving a feeding through the tube?
Then I would reattach the feeding tubing, unclamp the gastric tube, and restart the feeding, if appropriate for the medications administered.
Very good. You can remove your gloves.
Let me help you get comfortable, Mr. Esposito.
If the patient's receiving a tube feeding, the head of the bed must remain elevated at least 30 degrees.
How's that feel, Mr. Esposito?
Fine.
Good. I'm going to lower your bed now.
So, now you'll do hand hygiene and document the administration of the medication. Remember, you'll want to evaluate the patient's response to the medications within the appropriate time frame for the drug.
That would be it, Mr. Esposito. Can I do anything else for you? Get you anything? Okay, you know where the call bell is. Don't hesitate, okay?
We'll see you, Mr. Esposito. Thank you. All right, Ryan, what medications are you administering to your patient this morning?
He's prescribed a transdermal blood pressure medication. The patch is removed and reapplied weekly, and is due to be changed at 8 a.m. today.
What can you tell me about the transdermal route?
The transdermal route is being used more frequently these days to deliver medication. It involves applying a disc or patch to the patient's skin that contains medication intended for daily use or for longer intervals.
What do you need to watch out for?
Well, medication errors have occurred when patients apply multiple patches at one time. And sometimes they forget to remove the overlay on the patch that exposes the skin to the medication.
Right. These are important points to include when teaching a patient about these medications. So, what do we need to know about this particular medication?
Well, since it will lower his blood pressure, I need to be aware of his current measurement.
And why is that?
Applying the medication patch, if his blood pressure is already low, could make it go even lower. So if his blood pressure were low, I would want to check with the primary care provider to question administration.
Very good. It's always your responsibility to consider the appropriateness of the medication for your patient, and always make use of the 3 checks and the rights of medication administration. Any questions or concerns?
No, I'm set.
Okay then. Do you have the supplies you need?
I'll grab a disposable washcloth and blood pressure cuff and meet you in the med room.
All right.
Mr. Newman, hi. Remember me?
Ryan, good to see you again.
And this is Miss Warren, my nursing instructor.
Hi, Mr. Newman.
Instructor? Guess I need to be good, huh?
I appreciate it, Mr. Newman. Now, I'm going to be changing your medication patch for your blood pressure.
Good. This one is so last week.
Okay. Sign in on the computer and confirm your patient's ID.
Can I double check your ID band?
Here you are.
Thanks. And your full name is?
Alfred E. Newman. I kid you not.
Birth date?
March 7, 1949.
So, now I just need to scan your ID band.
Hey, look, I come up as fresh produce.
Thanks, Mr. Newman.
How's he doing, Miss Warren?
Very well. Ryan knows he always needs to complete all necessary assessments before administering any medications, like checking for any allergies.
That was my next step. Can I double check your allergy band?
Here you go.
Do you have any allergies?
Just penicillin.
Okay. Well, we don't have any penicillin for you, so that's okay. Now I'm just going to check your blood pressure. Just going to put this pillow under your arm, and I'm going to need to raise your bed. Is that okay?
Sure.
Okay, your pressure's pretty good. 128 over 78. Now, as I said, we're going to be changing your transdermal patch, which is the medicine we're using to treat your high blood pressure.
Ah, yes. It all comes back to me.
Talk me through what you're doing, Ryan.
Well, I already checked the medication label twice while I was preparing for administration. Now, I'll check the medication label for the 3rd time with the medication administration record and scan it. Clonidine, 5 milligrams is a patch, changed every 7 days, due to be changed today. Next, I put gloves on, of course, so my skin won't come in contact with the medication on the patch. I don't need to lower my blood pressure. you. Then, I assess the patient's skin where the patch is going to be placed, looking for any signs of irritation or skin breakdown.
Remember, the site should be clean, dry, and free of hair. You should also rotate sites.
Okay, where is the patch from last week?
On this arm.
Okay, so we'll look at this arm for an application site. This area looks pretty good. So, now I'll remove your old patch. Fold it in half with the adhesive side sticking together, and I discard according to facility policy. In this case, in the trash. Next, I gently wash the area where the old patch was.
Don't like the sound of that.
It just looks a little irritated to me. What do you think, Miss Warren?
I agree. Mr. Newman, do you change sites when you put the patch on at home?
Well, sometimes, but sometimes not.
You should rotate sites to decrease the chance of skin irritation.
Well, good to know. I'll do that.
Now, I remove the new patch from its protective covering. Then I initial and write the date and time of administration on the label side, correct?
Right. And when you remove the covering on the patch, make sure you don't touch the medication surface.
Okay, now apply the patch to the patient's skin.
Use the palm of your hand to press firmly for about 10 seconds. Do not massage.
How you doing, Mr. Newman?
Disappointed. No massage. What kind of spa are you running here?
Well, evidently, not a very good one. All right, that should about do it.
Okay, Ryan. Let's document the blood pressure measurement you obtained and confirm the administration of the medication in the computer.
Check.
And you'll also need to evaluate the patient's response to the medication within the appropriate time frame.
Got it. In this case, I'll be back to check your blood pressure around noon.
Sounds good.
Good.
See you later, Mr. Newman.
I'll be here. 3 shows daily.
So, what's next?
I have a patient who's receiving eye drops to treat glaucoma. The drops are timed for 10 a.m., so it's about time for me to administer them.
What else can you tell me about eye drops? When and why are they used?
Eye drops are instilled for their local effects. In this case, to help control intraocular pressure, which is a problem with glaucoma. Eye drops can also be used to produce pupil dilation or constriction, which is needed when examining the eye.
That's right. And they're also ordered to treat infections of the eye. So first you need to gather your supplies.
I got them right here.
Okay. And you should know the actions, special nursing considerations, and safe dose ranges of the medications to be administered.
I looked it up to be sure. And also the purpose of administration and any adverse effects. And I always keep in mind the 3 checks and the rights of medication administration.
You are responsible for the patient's care and always need to consider the appropriateness of their medication. What should we do next?
Well, now I can go to the medication room to get the medication and then go see the patient.
Okay, let's go.
Hi, Mr. Lee. I'm back.
Hi, Ryan.
I have Miss Warren with me. She's my nursing instructor. And I'm going to give you your eye drops.
Great, right on time. Nice to have someone to do it for me. I usually have to do it myself.
Glad I can give you a rest today. I need to see your ID band first. Thanks. And your full name is?
Kenneth M. Lee.
And your birth date?
April 9th, 1944.
Okay, now I'm just going to scan the barcode on your ID. Great. Thank you. Now, according to your chart, you don't have any known allergies.
That's correct.
So now we're ready to get to the eye drops, okay?
That's fine.
Remember, you've checked the medication label twice already when you prepared the eye drops, but now you need to check the label for the third time with the medication administration record, the MAR.
Okay, right. Timolol, ophthalmic, 0.25%. 1 drop to each eye at 10 a.m. Looks good. Here, you may want a tissue.
Thank you.
Now, I'm going to clean off your eyelids. There we go.
Thanks.
Okay, Mr. Lee. Ready?
Yes.
Okay. You're going to tilt your head back. A little bit more. Perfect.
Why is it important not to touch the inner side of the cap?
Because that could contaminate the entire bottle of medication.
Right. Now, talk me through what you're doing.
Okay, Mr. Lee. I want you to focus on something on the ceiling. That's good. Now, I'm going to move your lower lid down a bit.
This is important. Be careful to hold the dropper close to his eye, but avoid touching the eyelid or lashes. Where should the drop go?
The eye drop should be placed in the conjunctival sac, not directly on the eyeball. I hold the dropper like so, squeeze the container, and allow the prescribed number of drops, 1 in this case, to fall into the lower conjunctival sac. Very good, Mr. Lee. Now the other eye. Good. Now, close your eyes gently. I'm going to put gentle pressure on the corner of your eyes to prevent the drops from flowing into the tear ducts. Good. And don't rub your eyes, okay?
No problem.
You can relax now.
So, Ryan, why is it important to administer the drops into the conjunctival sac and not on the cornea?
Applying it to the cornea could injure it or cause the patient to have an unpleasant sensation.
Right. And it also minimizes the risk of any systemic effects from the medication.
Okay, so now I'll document the medication in the MAR.
Good.
Thank you, Mr. Lee. Your doctor will be in shortly. Anything we can do for you before we leave?
No, but thank you.
You're welcome. I'll be back. Just use your call bell if you need anything.
Okay.
What are we going to be doing next?
I'll be instilling eardrops in a patient who has an ear infection.
Okay. Why else might eardrops be prescribed for a patient?
Drugs are administered into the auditory canal for their local effect. They're used to soften wax, relieve pain, apply local anesthesia, and in this case, treat infections.
Right. Both ears?
No, just the left.
Okay. If you were treating both ears, you would wait 5 minutes before instilling drops into the second ear to avoid causing the medication to run out immediately after administration.
Right.
And you know the actions, special nursing considerations, and safe dose ranges of the medication to be administered?
I do, and why I'm administering the drug and any adverse effects.
And of course, you always make use of the 3 checks and the rights of medication administration.
Sure do. And I have to consider the appropriateness of the medication for the individual patient each time.
Good. So, what's next?
Next, we'll get the medication ready and go see the patient.
Great.
Good morning, Mrs. Park. My name is Deborah. I'm a nursing student assigned to care for you today. And this is my instructor, Miss Warren. How are you feeling today?
Fine, I guess, considering I'm in the hospital.
Oh, anything in particular you want to talk about today?
No, I just miss my family.
Oh, I understand. Well, we're here to give you your eardrops.
Oh, good. It makes it feel a lot better. You know how to do it, right?
Absolutely. First, I'll need to see your ID band on your wrist. Thank you. And what's your name?
Rose Park.
And your birth date?
October the 29th, 1948.
Thank you, Mrs. Park. I'll scan the barcode on your ID band. Good. Now, your chart says you don't have any allergies.
Not that I know of, but you never know.
No, you never know until you actually use a medication. But you've been receiving these eardrops for a few days without a problem, right?
Yes, no problems.
Okay, last thing before we give you the drops, check the medication label for the 3rd time with the MAR. I already checked it twice when I was preparing the drops. Ofloxacin otic solution, 0.3%, 10 drops at 9 o'clock. Got it. And then scan the label. So now we're ready. These drops will help treat your ear infection.
Will it burn?
No, it should just feel a little cool.
I was just afraid it might burn.
I understand. Well, these haven't bothered you before.
You're right, they haven't.
Ready to get started? Here we go. Okay, since it's your left ear, I want you to lie on your right side.
Like this?
That's great. I'm going to put your bed up. Good. Now tilt your head so that your left ear is at the highest point. Good. Let me look at your ear first. Doesn't look too bad, just a little red.
Oh, it's improved in the last few days then. My husband said it looked like I'd been in a boxing match.
Oh my, it must have been really swollen. So tell me what you're doing, Deborah.
Well, first I straighten the auditory canal by pulling the pinna up and back.
Should you numb this first?
No, Mrs. Park, it won't hurt. As a matter of fact, I'm doing it right now.
One can't be too careful, you know.
I hold the bottle with the tip above the auditory canal, and I don't touch the ear with it.
I'm okay, right?
You're doing just fine, Mrs. Park. Now I'm going to allow the drops to fall on the side of the ear canal.
That's good. It's uncomfortable for the patient if the drops fall directly onto the tympanic membrane.
You won't do that, will you?
No, the drops are already in. Now I'm going to press on the outside of your ear.
Pressing on the tragus, a part of the ear, causes the medication to go down the ear canal, which is where it needs to be.
Now I need you to stay in this position for just a little bit, about 5 minutes, to make sure the medication stays put, okay?
If you say so.
Okay. Put your bed back down. I document the medication in the MAR.
Perfect. Now, of course, the follow-up assessment related to this medication is to continue to monitor the condition of the patient's ear.
Got it. And that's it, Mrs. Park. Thank you. Anything else we can get for you before we leave?
My stomach's been gurgling.
Well, have you eaten lately?
No.
Would you like to try some yogurt?
Strawberry would be good.
I'll be right back with that. Anything else, you know where the call bell is.
Oh, I sure do.
Great.
Mr. Lumet. How are you? This is my
Lumet?
nurse instructor, Miss Scott.
Hi.
And I'm here with another suppository for you for your fever. Is that all right?
That's fine, Melissa.
Okay, great. Let me just check your armband. Can you tell me your name?
Max Lumet.
Okay. And do you have any allergies?
I sometimes get a little sniffly around cats, but other than that,
Right.
none to speak of.
Right. So I'm just going to check your information here with your medication. Okay.
Good.
And we're going to push this out of the way so we can get you comfortable, all right? All right. How's it been so far? Just stay here.
Fine so
Nice,
far.
they're treating you
Good.
good. Okay, so I'm going to need you to turn over onto your side. All right. Okay, good. This one we do.
Now remember to generously lubricate both the suppository and your gloved finger, okay?
Okay, so I'm going to touch you now, Mr. Lemon. I want you to take a few deep breaths through your mouth, and then I'll insert the suppository.
Okay. Now, with your index finger, insert the suppository beyond the internal sphincter. And that'll be about 4 inches in adults and 2 inches in children and infants, okay?
Okay, great. All finished, Mr. Lumet.
Okay.
So we're just going to get your cover back over and have you roll over. Now you're going to need to remain still for the next 5 minutes, just to allow the medication to absorb. And the suppository has to remain in place up to 30 to 45 minutes, so try not to go to the bathroom. So here's your call button right next to you, if you can see it there. And, you know, just give us a call if you need anything, and I'm going to come in and check on you later to make sure that the medication is working and your fever is dropped, all right? All right.
Okay. You did well. Hope you feel better.
Just going to chart here.
Okay, you put it on the MAR.
So we'll let you rest. Thanks so much.
Hi.
Okay, Ryan, tell me about your patient.
He was recently diagnosed with emphysema. He's been prescribed a meter dose inhaler as part of his treatment.
And what's the medication?
It's a combination inhaler, albuterol and ipratropium. He gets 2 puffs 4 times a day. The patient's been using this in the hospital. Today I'm going to review and reinforce how to use it as part of getting him ready for discharge.
What can you tell me about a meter dose inhaler, an MDI?
A meter dose inhaler is a handheld inhaler that uses an aerosol spray or a mist to deliver a controlled dose of medication with each squeeze of the canister.
Where does the medication go?
Into the lungs, where it's absorbed rapidly through the lung tissue, resulting in local and systemic effects, as long as the patient uses the inhaler properly.
Which is what we're working towards.
Right.
Okay, if you're ready, let's get the medication, then we'll go see your patient.
Mr. Stern. Hi, it's me, Ryan.
Time for my class. Who's that with you?
This is Miss Warren, my instructor.
So she'll grade you while you're grading me, huh?
Something like that. Before we begin the challenge, can I check your ID band?
Your forgetfulness is starting to worry me, young man.
Well, what can I say? And your full name is?
Walter Zachary Stern.
Birthday?
Too many. September 13th, 1939.
Great. I'm just going to scan the barcode on your ID band. Thank you.
Ryan, what assessments should you complete before giving Mr. Stern the medication?
Well, I need to listen to his lung sounds.
Correct. Good thinking. Anything else?
For this medication, we should assess his pulse rate, right?
Exactly. Assessing both of these things provides a baseline to determine the effectiveness of the medications and assess for any adverse effect. In this case, an increase in pulse rate.
Okay, Mr. Stern, now I just need to take a listen.
So you do all this assessing like 10 times a day. So what gives?
Well, we'd like to make sure that what we're doing for you is working. In this case, I want to be sure that the medication is helping your breathing.
Okay, that makes sense. Though I might miss all this attention when I go home.
You just might. Deep breath. Just going to take your pulse. Great. Can I also have a look at your allergy band? Any allergies you know of?
Some dogs, shellfish.
Well, we're in luck. No hot dogs or crab on the menu.
Good, because I'm crabby enough.
Now, as we talked about, I'll be going over how to use a meter dose inhaler. It gives you medications to help improve your breathing as part of your treatment. Okay?
Sounds good.
Ryan, tell me what you're doing, please.
Sure. I've already checked the medication label twice while I was preparing the medication. So now I'll check the label with the medication administration record for the third time and scan it. Okay, now this, as you know, is an inhaler. You remove the mouthpiece cover from the MDI and from the spacer. Then attach the MDI to the spacer. Now, you try it. Good. Right. Now shake it.
Shaken, not stirred. Got that?
Good. Shaking helps to make sure that you'll receive the correct dose of medication.
What a taskmaster.
Now, let me go over the next steps before you do them. You're going to place the spacer's mouthpiece in your mouth and grasp it securely with your teeth and lips. You will breathe normally. Then when you're ready, depress the canister, releasing one puff into the spacer. Then inhale slowly and deeply through your mouth. Then you're going to hold the breath for 5 to 10 seconds, or as long as possible. Then exhale slowly through pursed lips. Got it?
I think so.
Good. Okay. In your mouth. Breathe normally. Depress the canister. Inhale. Try to hold it just a little longer. Now, exhale slowly through pursed lips. Well done. You can relax now. How'd that make you feel?
Well, I'm no pearl diver, but I can still hold my breath for 10 seconds.
Good. Your prescription calls for 2 puffs with 1 minute in between them, so we'll need to wait to do the second one.
Fine. You know, I always thought that you just puffed and that was it. No breath holding or...
Many people do it incorrectly. Characters with inhalers on TV especially, they often get it wrong.
Well, thanks for shaking my faith in television medicine. So, how often do I do this?
2 puffs, 4 times a day is the prescription.
Okay. Not a big deal.
Okay, we've waited a minute. It's time to do it again.
Good, Ryan. You always want to wait 1 to 5 minutes between puffs to make sure the first puff is absorbed.
Right. Okay, Mr. Stern. Place the mouthpiece in your mouth. Good. Just like before, depress the canister. Very good. Inhale slowly, deeply, and just through your mouth. Give it at least 5 to 10 seconds if you can. And you're going to exhale slowly through pursed lips. And go ahead. Excellent.
Yeah, I guess I can suck wind with the best of them.
Now, remove the MDI from the spacer and replace the caps on both. Great. Now, here's some water. You need to gargle and rinse after using this MDI.
Here you go. I'll dispose of this.
So I want the medicine in my lungs, but not hanging around my mouth and throat, huh? I get that right, Teach?
Very good, Mr. Stern. Rinsing minimizes the chance for dry mouth related to these particular medications. You'll be an expert yet.
Okay, the last thing is, clean the MDI and spacer according to the manufacturer's directions. Normally once a week. They're in the information I gave you earlier. Let me know if you have any questions after you look at it.
Got it.
Now, document the assessment you obtained earlier and confirm the administration of the medication in the computer.
Okay.
And remember to evaluate the patient's response to the medication within the appropriate time frame.
Right. So I'll be back in a half an hour or so to reassess your respiratory status and your pulse. Okay, that's it. Well done, Mr. Stern. Do you have your call bell?
Oh, yeah, sure. It's right here.
Need anything else before we leave?
Yeah, a good grade. Did I pass, teach?
With flying colors.
Guess I can breathe easier, huh?
Hi, Miss Warren.
Hi.
I have a medication due now for my patient. Do you have time?
Sure, Ryan. Tell me about your patient.
My patient was admitted with an exacerbation of her COPD and bronchitis. She was prescribed a bronchodilator as part of her treatment.
It's administered via nebulizer?
Right. Albuterol, 2.5 milligrams via nebulizer every 4 hours.
Tell me about how a nebulizer works.
Nebulizers disperse fine particles of liquid medication into the deeper passages of the respiratory tract, where absorption occurs.
Right. Keep in mind the actions, special nursing considerations, and the safe dosage range for the medication. What else should we consider?
The purpose of administering the treatment and any adverse effects of those medications.
Good. And of course, use the 3 checks and the rights of medication administration.
That's right.
Okay. If you're ready, let's get the medication and go see your patient. All right.
Mrs. McAdams. Hi. I'm Ryan. Remember me from earlier?
Not really. I'm sorry.
That's okay. As I said, my name's Ryan, and I'm a nursing student helping to care for you today. This is Miss Warren. She's my instructor.
Oh, hello. Have we met too?
Just this minute, Mrs. McAdams.
Oh, good. I'm beginning to worry.
Mrs. McAdams, we're here with the medication to help you with your breathing. The one you inhale through the tubing?
Oh, yes. I remember doing that earlier.
Yes. You've been receiving it for the last 2 days, I believe.
Mm-hmm.
Can I check your ID band?
Sure, surely.
It's on your wrist.
Oh, there you go.
And can you tell me your full name?
Mrs. Emily Rose McAdams. Excuse me.
When's your birthday?
October 24, 1929.
Thanks, Mrs. McAdams. I'm just going to scan the barcode on your ID band. Now, may I listen to your chest to check your breathing?
We'll go right ahead.
Good, Ryan. And you'll also want to measure her pulse.
That's right. We need to check that her heart rate doesn't increase too much.
That's right. Not that it should be a problem, since you didn't have any issues with previous doses. And assessing your lungs provides a baseline to determine the effectiveness of the medication.
No, my breathing feels much better than when I came, but no problems.
Okay, I'm just going to raise the bed and the head of your bed. Going for a ride. You doing okay?
Yep.
Great. And here comes the head. You doing okay?
Yeah.
Great.
I guess.
Just relax. Now, Mrs. McAdams, I'm going to slip my stethoscope under your gown to listen to your breathing.
I'm fine.
Okay. Now, deep breath. And out. Great.
Thank you.
Lay back down.
Okay, thank you.
Comfortable? Okay. I'm just going to check your pulse, Mrs. McAdams. Okay. I don't see an allergy band. Do you have any allergies?
Only in the springtime.
Not allergic to any medications?
Oh, no, never had any problems with medicines.
Good. Thank you. Now, just like before, I'll be giving you a treatment using a nebulizer. The medicine mixes with the oxygen, and you inhale the mist.
If you say so.
Ryan, what's first?
Well, we already checked the medication label twice when we were preparing it. So first, I checked the label with the medication administration record for the third time. And scan it.
Mm-hmm. Okay.
Okay, so then we remove the nebulizer cup from the unit and open it.
Mm-hmm.
Then I place the pre-measured unit dose medication into the bottom section of the cup.
Good.
Now, I take the top portion of the nebulizer cup and screw it back in place. And attach the cup to the nebulizer. I attach one end of the tubing to the stem on the bottom of the nebulizer cup and the other end to the oxygen source.
Mm-hmm. Then have the patient place the mouthpiece into her mouth and grasp securely with her teeth and lips.
Okay, Mrs. McAdams, just put this in your mouth.
Mm-hmm. Mm-hmm.
Grip it with your teeth, your lips too. Good.
Okay, I'll turn up the oxygen 6 liters per minute.
Oxygen's on.
Check that a fine medication mist is produced.
Now, I want you to inhale slowly and deeply through your mouth. And hold each breath for a slight pause before exhaling. That's good. It doesn't need to be too long.
Continue this inhalation technique until all the medication in the nebulizer cup has been aerosolized. This usually takes about 15 minutes. Once the fine mist decreases, gently flick the sides of the nebulizer cup.
We'll get that little last bit of medicine. You're doing really well, Mrs. McAdams. Okay, I think we're done. How do you feel?
Well, like Jacques Cousteau must have felt in his scuba gear.
Jacques Cousteau. Does he have a son? I think I may have seen an underwater documentary about him once.
Oh, I believe so. I guess it runs in the family. Or swims, you might say.
Now, here's some water. You'll need to gargle and rinse. Rinsing minimizes the chance for dry mouth related to this particular medication.
Here you go. That's good in there.
Thank you.
You can just put that in there too.
Good.
Doing well?
That does feel better.
Now, clean the nebulizer according to the manufacturer's directions.
In this case, we rinse with sterile water.
Right. Ryan, don't forget to reassess Mrs. McAdams' pulse.
Oh, right. May I take your pulse again?
Oh, sure.
Okay, great. Now I'm going to put your bed back down.
Okay.
Going for another ride.
Yep.
Now, document the assessment you obtained earlier, as well as her pulse rate after the treatment. Confirm the administration of the medication in the computer.
Okay, there we go.
And remember to evaluate the patient's response to the medication within the appropriate time frame. Plus, reassess lung sounds and respirations and oxygen saturation if ordered.
Right. I'll be back in half an hour or so to take another listen to your chest, okay?
That's fine. I like the company.
Good. That's it for now. Well done, Mrs. McAdams. Do you have your call bell handy?
It's right here, thank you.
Need anything else before we go?
Oh, no, thank you. Ryan, how about that? I remembered.
Great.
Yes.
Very good, Mrs. McAdams.
Thank you.
We'll see you later.
Good. Okay.
Here you go. So tell me about your patient, Deborah.
She is in with a foot wound, but she has a history of asthma. She uses an inhaler as part of her asthma treatment.
And the medication?
Fluticasone and salmeterol in a dry powder inhaler, or DPI, 1 inhalation 2 times a day.
So what can you tell me about DPIs?
Dry powder inhalers are a type of delivery method for inhaled medications. The medication is supplied in a powder form, either in a small capsule or disc inserted into the DPI, or in a compartment inside the DPI.
Good. How do these inhalers work?
They're breath activated. A quick breath by the patient activates the flow of medication.
Very good. You're right. What is the benefit compared with an aerosol inhaler?
A DPI eliminates the need to coordinate activating the inhaler, spraying the medicine while inhaling the medicine at the same time.
Okay. If you're ready, let's go and get the medication, and then we'll go see your patient.
Morning, Mrs. Gray. It's me, Deborah, again.
Hello again.
This is Miss Morin, my instructor. We're here to give you your inhaler.
I've been using that for a while.
May I see your ID band? Mm-hmm. Thanks. And your full name is?
Diane Elizabeth Gray.
And your birthday?
February 15th, 1955.
Thanks, Mrs. Gray. I'm just going to scan the barcode on your ID band.
Huh.
Is it okay if I take a listen to your lungs?
Yes.
Okay.
Very good, Deborah. Assessing her breath sounds and counting her respiratory rate provides a baseline to determine the effectiveness of the medications.
Okay. Take a deep breath in and out through your mouth. Thank you. Just fasten you back up here. There we go. Thank you. I see you have an allergy band. Let's see, aspirin. That doesn't present a problem for this medication. Any other allergies?
Not that I know of.
Okay, good. So I've already checked the medication label twice while I was preparing the medication. Now I check the label with the medication administration record for the 3rd time and scan it. Looks good. So we're going to be giving you your asthma medicine using a DPI, a dry powder inhaler, okay?
Sure. Oh, it looks just like the one I have at home.
Okay, do you have any questions?
No, it's pretty simple.
Well, would it be all right if Deborah reviewed how to use it? It would be a good experience for her, and maybe she'll mention something new for you to pick up.
Sure. Nurses need to know a lot, so I'll be glad to help.
Okay, thanks, Mrs. Gray. First, uncover the mouthpiece.
Okay. This is just like mine at home.
Good. You know how to activate the inhaler, of course. In this case, slide the lever over.
Have Mrs. Gray breathe out slowly and completely and without breathing into the DPI. That way she can take a deep breath in with the medication dose.
Let's do that, Mrs. Gray. Just breathe out nice and slow, but not into the inhaler. Then you're going to place your teeth over the mouthpiece and seal your lips around it. Remember, Mrs. Gray, don't block the opening with your tongue or your teeth. Ready? Now breathe in quickly and deeply through the mouth for longer than 2 to 3 seconds, just like at home, right? Great, and this will activate the DPI. You can relax now. How did that feel?
I do it a little differently at home. I didn't know that I was supposed to breathe in quickly like that.
Well, you did a good job this time. I'm glad we went over this together.
Now, if the prescription had called for a second inhalation, what would you do?
Wait 1 to 5 minutes to let the first puff be absorbed before giving the next puff. But Mrs. Gray, your prescription calls for...
1 puff twice a day.
Right. Now here's some water to gargle and rinse. You always do that at home, right?
Yes, I do. Thank you.
Great.
How long have you had asthma?
Forever, it feels like.
Really?
Yeah, but I think it's getting better with this medicine.
Good.
Yeah.
Good.
I breathe better. I don't worry.
Oh, well, that's nice.
Always have to do that.
Mm-hmm.
The last thing is to clean the MDI. For this one, you wipe off the mouthpiece.
Okay. This is how I do it at home.
Thank you. I'm just going to close it up. Now, I document the assessment I did and confirm administration of the medication on the computer.
And remember to evaluate the patient's response to the medication within an appropriate time frame.
Right. I'll be back in a half an hour to listen to your lungs again. So it looks like I'll see you again at 10 o'clock, Mrs. Gray.
Okay.
You have your call bell handy, right?
Yes, I do.
Do you need anything else before we leave?
Well, some juice would be good.
Orange, apple?
Oh, apple would be fine, thanks.
You're more than welcome. I'll be right back.